Today is an exciting afternoon. I get to have a great conversation with Jenny Kaiser. She has perpetually asked me questions to push my thinking and to push how I view things. And that has been, it's always great to have people in your life that push you and help you become a better version of yourself. So thank you, Jenny.
Yeah, it's great to be here. So I started my journey into the holistic kind of mind frame about 15 years ago when we started drinking raw milk, right? And then when you go that route, you just do a deep dive and keep going and going until about 4 years ago, I learned more about holistic dentistry and started questioning the things I did and got some resources, and that's when I started changing some of my things. And when I first started doing it, I didn't tell you about it, and so I was really curious. When I came to my first appointment after doing things like 6 months, stopping regular toothpaste and changing to a salt water wash, and using basically just salt and baking soda for brushing my teeth, I was really curious about how my rating was going to be when I came in for a dental appointment. But nothing changed. Like, I didn't go downhill, and I was still healthy and everything. And so I just kept going into that. And then we started talking about it, and I started asking more questions and kind of opening it up. But I'm curious for you, when did your journey start? So recently you've become more holistic in your thinking and gotten more training. So what moved you to go in that direction?
That is a very good question. There's a lot of levels to that because really kind of the health optimization has been a journey that I've been on with my family for years of how do you kind of optimize your life with diet and exercise and stress reduction and sleep and so many of those areas that really push the needle on you as a whole person. And so that was really the first kind of steps of how do we improve our life as a whole. And Cheryl ended up walking through a whole bunch of health issues. And as we walked through that process, getting involved in functional medicine and going through different methods of healing that were not the traditional paths of medicine. Mm-hmm. And in doing that, seeing some incredible changes in her life. And one of the doctors that she was being treated by, there was a book in there called The Hidden Epidemic by Thomas Levy about root canals and their effects on men with heart attacks and women with breast cancer. And she was reading it in the waiting room when the doctor came out, and he had just said, he finding that book interesting. And she goes, my husband's a dentist. And he said, take that, have him read it. And I ended up reading that book. And Thomas Levy's a fabulous author because his books are completely filled with research. I think he's got like 500 or 600 peer-reviewed articles in his book. And so it was an excellent book because I am kind of a hardcore science nerd, and I love that. And so being able to read the published literature along with it was very, very influential for me. Mm-hmm. And I remember reading through that book and then stopping and talking to Cheryl, and this is one of those books where either this guy is completely lying or I have to completely shift my paradigm of medicine and dentistry. Mm-hmm. And I think that was really a great book to be reading because he's not a dentist, but he is really pushing dentists to change how they are looking at oral health and the oral systemic connection. Mm-hmm. And it's often one of the areas in dentistry that a lot of dentists are very timid to take that step, is that we'll stay inside the mouth, but I'm not going to look anywhere else. And if you have that mindset, you really can't be a holistic dentist. I mean, truly, fluoride would be the best decision, because if you're just talking about the teeth, then that's all we care about. But if we care about the whole body, then we have to make different decisions. So that was really the kind of the big step, the big change that happened for me. And going through that really opened up kind of my mind to see things very, very differently.
Yeah. Why do you think dentists are afraid to kind of cross that threshold into looking more holistically?
Why are they afraid to cross that threshold? Well, I think part of it is the problem with all of medicine and dentistry. You cannot become a doctor or a dentist, a medical doctor or a doctor of dental surgery without being somebody who fits very well inside the boxes. Because you go to undergrad and you have to really knock it out of the park in undergrad. You have to interview great. You have to be phenomenal on standardized tests. Then you turn around and go to 4 more years of school that is crazy. And again, every step of that way, you're doing standardized tests, you're doing national boards, and so you have to learn to think as part of the conglomerate, part of the system, yes. Because if you don't, you won't graduate. A, you won't get in, and B, you won't graduate. So they, in my opinion, you kind of selectively weed out people who are bucking the system or who don't accept what is taught. So if you walk through classes going, is that real? Is what I'm being taught real? Then you don't graduate. And so, I mean, I fought and studied my tail off just to get through, to get my doctorate. And if I had questioned everything all throughout it, I don't know if I could have. Right. So I think that just because of the way the educational system is set up, I think that prevents that mindset. So it's not necessarily that doctors and dentists are so opposed to it. It just, you really are selectively choosing people that operate really well inside the system. Right. If you don't operate well inside the system, you tend not to make it.
And if there's no opportunity to question anything within, once you get out, you're not even thinking about those possibilities unless you come across somebody who's pushing against
Correct.
Right.
And it's really, really tough. Dentistry and medicine is tough. The amount of hours you end up working to get through school, and then when you get through, the isolation that you have, particularly in dentistry, because still the vast majority of dentists work alone. And so they have nobody to bounce things off from. They have nobody to have high level relationships, professional relationships with. And you just get bogged down in you gotta keep going, gotta keep going, gotta keep going. I read a research article that was talking about dental materials and the reason that various doctors use various dental materials. And the number one reason that they use a dental material is because it was what they were trained in dental school. That's not a very good reason to use a dental material, because I've been out 16 years. We've had a lot of science happen in 16 years. But there is like a standard composite filling in the back of the mouth has 40 to 60 steps in it. So once you have those 60 steps memorized, you don't really want to perturb the system again. And once you've established, hey, I'm really good at this sequence, you tend to not mess with it. So it's hard to become somebody that is questioning everything that you know and everything that you do.
Yeah, it sounds like when you're doing those procedures, it's so technical and you put so much time and effort into training for that technicality. To always be looking for some way to switch it is very time consuming and just not profitable, probably, right? So I've heard this before, and let me know if this is true or not, that it takes about 20 years before the research reaches the practice.
Oh, that's a great question. I think that it really has to do with who you are as a doctor and what you're talking about specifically. And also how aggressively you love continuing education, or seek out continuing education. Whether you love it or not, I guess, is a little bit of a moot point, but how aggressively you seek out continuing education. If all states are different, but it seems to me that most states require doctors to have somewhere between 10 and 20 hours a year. And some of those are mandated. We have to have drug training, we have to have ethics training, and there's a handful of them that we have to have, which there's nothing wrong with that. But once you remove all of your mandated training, there's only a few hours left. And so it becomes difficult to change up a system. And if you're seeing research that deeply perturbs your ability to work, you need a lot of hours to sink into that, to really change how you process or what you do. So I think that it's very difficult to answer that correctly, because I think that you're going to find some doctors that don't ever change. What they learned in dental school is what they're going to practice when they retire. And then you're going to have other doctors that are changing stuff up every 3 to 5 years. And unfortunately, I don't know how to identify that difference on the outside, but I do agree with you that it takes a long time. There are some doctors that are aggressive on learning and implementing, and there are others that I'm not going to do anything until I'm forced to do it.
Yeah. Okay, so how would you define your practice now? Holistic, functional, what terms would you use to describe?
I would choose the word holistic. A lot of people are kind of pushing in dentistry towards biologic. I personally don't like that, because I feel like we've just changed one puzzle piece for another puzzle piece, but we haven't bothered to look at the whole puzzle. When you're talking about biologic, you're trying not to damage systems, which I agree with that 100%, but we're still very narrow. We're still really talking about the mouth, and we're not talking about the whole body. And so that's really my reason for saying I like holistic more than others.
Right. Okay, so how does that manifest in your practice? What has changed, since you've started
conversations. When I have a conversation with a patient and discussing what I would call the base, kind of 4 to 8, depending on where you want to separate them or dice them, of a holistic life, because we're no longer just talking about dentistry, but we're talking about your life and your health. And sleep, I would always put as number 1. Diet, I always put as number 2. Exercise, I would put as number 3. Balancing your autonomic nervous system, I was put at number 4. We would have supplements. We'd have purpose, toxins, and infections.
Okay, now you didn't mention your teeth in any of those.
I did not. Okay. Not once.
So you think those are precursors? Those cause better oral health? Or does oral health?
Oral health falls into many of those.
Okay.
So infections, we'd have oral health would fall into infections. Mm-hmm. Toxins, oral health would fall into toxins. We could talk about fluoride with that one. Yeah. We could also talk about periodontal disease, and root canals would be 2 other things that could be talked about under infections and toxins. Diet would be huge, going the other direction towards decay. Biggest influencers whatsoever in tooth decay is going to be what you eat and how often you eat. So that's diet directly into tooth decay. Then balancing the autonomic nervous system, you would have sleep. And so if you have sleep apnea, which is airway, dentally involved there, sleep apnea, you're not going to get good sleep if all night long somebody's sitting there with a pillow, and as soon as you drift off, they cover your mouth with a pillow. You're never going to have good sleep. And in essence, that's what's happening with your tongue. You start to drift off, and then your tongue blocks your airway. And then you wake back up. And so you never get good sleep. And good sleep is going to go right back into balancing the autonomic nervous system. If you can't balance your autonomic nervous system, you spend your entire life in fight or flight. If you spend your entire life in fight or flight, you never get into rest, digest, and heal, and so you can't ever heal anything. And so we're in this perpetual state of stress. And one of the areas that, again, the oral health comes directly into that is if you're having TMJ issues. You end up with your jaw traditionally shifted backwards. It's pushing on the sympathetic plexus, right in the cervical plexus, and it forces you into sympathetic. Under Armour has absolutely capitalized on this with their sports mouth guards. And they talk about being able to get you to get somewhere between 5% and 15% higher 1 rep and 3 rep maximums in sports. What they're doing is they've got a mouth guard that's shifting the jaw forward to get your condyles off the sympathetic plexus. So you're getting out of sympathetic reaction, which allows you to recruit more muscle fibers. It's truly amazing.
Yeah. So is that something that you could treat in your office of TMJ?
Yes. Yes. So very much what I'm doing is I create a orthotic for the mouth so we can get the jaw off from being pounded back against the nerve plexus. And then also I'm using something called prolotherapy, where I draw your blood. I throw away about 80% of it, so we save the chemo factors, and then we inject that into the jaw joint along with ozone. And really is amazing, doing great things to relieve pain and then also stimulate healing inside the jaw joint.
Yeah, so it sounds like you're looking at more symbiotic relationship between the mouth and other parts of your body, so they both affect each other and in
Yes.
each of those stages that you listed out.
100%.
Yeah.
And it's fascinating to me how I've never heard about prolotherapy. When I graduated, we had 2 options: soft diet and ibuprofen, or jaw surgery. We're going to cut the condyles off and replace them with either ceramic or stainless steel or titanium. And there's no middle ground. Those are some pretty wildly drastic options. So being able to do prolotherapy is fabulous, and it's amazing.
What are some other therapies that you can do that are less invasive? So let's go back, I guess, to the book that you started with about root canals.
Yes.
Right? Okay, so I've seen a lot of holistic dentists are coming over my social feed now, my social media feed. And so I've seen a lot of pushback from those dentists, and I want to hear your opinion of how root canals aren't necessarily necessary or they're harmful. So I guess, where do you stand on that? What did you learn from that book?
So I guess I need clarification. So root canals aren't necessarily necessary, or they're harmful?
Or there are alternatives, or that the main message is they're harmful. Don't go to a dentist who does root canals is a message I've seen on from some holistic dentists.
So I have a little pushback on that statement, don't go to a dentist that does root canals.
Yeah.
Because if your goal is, again, we have to ask the patient, what is your goal? If my goal is to get away from disease rather than shooting for health, then I respect my patient's desires.
Yeah.
And so if there's a circumstance where the patient's like, I know the best thing for me is to take this tooth out and to replace it with a ceramic implant, I understand that, but I want a root canal. Then do I say, I'm sorry, there's the door, out the door you go? I mean, you can, but I think that that's very much forcing my belief system on other people. So generally speaking, I will refer to an endodontist. There are restorative complications sometimes that require certain interventions. But that to me is, every single person is not the same. That's part of the reason that I love holistic dentistry, is really looking at each person individually. So then if you switch over to holistic dentistry and then you just create a new cookie cutter, is it really any different, in my opinion? I do not think that a root canal is the best decision for health. If your goal is to get yourself out of pain, to buy yourself some time, it is an option. With that, if you're still trying to maximize health, you should be taking tests for C-reactive protein to see whether you have a systemic chronic infection going on around that root canal. That really is the most important thing, is you need to understand what it is. There is no way to sterilize a root canal. Everybody likes to think of the nerve inside the tooth as like a carrot, just a straight line. It doesn't look like that. It's got little offshoots, little threads, lots of small tubules that go every which way. If we got 10% of those clean, you're a phenomenal dentist, period. You are doing a phenomenal job at a root canal. You are not going to get 100% of those clean. It is not possible. If you did, you'd be, God level. And we don't have anybody that can do that. And endodontists know that. That is not something that endodontists are somehow like, oh my goodness, I'm not sterilizing the root canal. No, we all know, anybody who does root canals knows that we are working to do the best we can, and then we position the body to do the rest.
Okay.
And
so maybe we should pause here and define for those who don't know, what is a root canal?
What is a root canal? So inside a tooth is the nerve. So we have the root structure itself, and then inside is a nerve that has the nerve, a vein, and an artery. And so when the tooth dies and it is completely dead, at that point, we have to make a decision. And this, I think, is probably where we get that misunderstanding, where doctors say, oh, a root canal is not necessary. Mm-hmm. And where I think that misunderstanding happens is when you have a tooth that hurts, but it's still alive. And if you have a tooth that hurts, but it's still alive, for me, you don't need to do a root canal yet. We can treat it with ozone. We can treat it with prilocaine. I've got options. We can treat it with photobiomodulation. So we can do some stimulation, light stimulation, ozone. We have options. And as long as that tooth is alive, we can keep treating it to help it along in the healing process. Once the tooth is dead, I can't make it alive again. We can't Frankenstein your tooth. And so that's where, when I hear these statements, they're misleading because they take a very complex subject and they press it down to 3 words. Sure. So if the tooth is dead, that tooth either needs a root canal or it needs to be extracted. Leaving it in the mouth is a very, very bad decision. Mm-hmm. And that concept of, a root canal is a horrible thing to get, is being seen in functional medicine doctors. And it's been something that I personally haven't had it happen, but several colleagues of mine have had this scenario where you end up with a functional medicine doctor comes in and they have an abscess in their tooth. And this abscess has been going on for years because they refuse to get a root canal. Well, you are way better off getting a root canal and dealing with the partial infection of a root canal than to leave a wild infection going on. So if you don't want to get a root canal, that's fine, but don't ignore it. You have to deal with it because you have a dead piece of body sitting there. So if you don't want to do a root canal, that's fine. That is your decision, but take that dead piece of the body out and get it out of there.
Okay. So this really highlights the fact that as a holistic doctor or dentist, you are looking at the patient, what are their goals, what is their stage of decay, and offering a range of choices, not just, I see one thing and this is my method.
Yes.
Yeah. Okay. So you mentioned ozone. How does that come into play in holistic?
In holistic dentistry. Okay. So there's a lot of ways that it comes into play. So it has a lot of different functions. If we're using it topically or on the surface of the teeth, I use it basically in one way, and that is it's high concentration, and I'm using it to kill everything that is not a complex mammalian tissue. Mm-hmm. We're mammals, we have complex mammalian tissue. So if we spray ozone on our tissue, our body has the enzymatic ability to break that down. Bacteria? No. Viruses? No. Funguses? No. Parasites? No. So that's a pretty awesome list of people I can kill and not kill our tissue. Yeah. And so when we take out an infected tooth and I'm detoxifying the socket, I can use high concentration ozone down inside that socket to kill bacteria, funguses, parasites, and viruses, which is fabulous because I can selectively kill them in those areas without destroying the natural bone. Along with that, the natural bone, well, not just bone, all of the soft tissue likes ozone. It increases vascularization, decreases inflammation, pushes the macrophages towards healing and away from inflammation. So there's a lot of fabulous things that happen. If we're going to inject it into the tissue, we use a lower concentration, but it does all of those things I just mentioned. Increases vascularization, decreases inflammation. It's wonderful. And so using ozone, we use it selectively depending on which direction we're going to go. But those are the ways I use ozone.
Okay, so I've had ozone therapy before, but for those who haven't, what does it look like? What are you actually doing? How does it get in your body?
So ozone itself looks like, or the therapy looks like? The therapy. So because ozone itself is gas. And so I can inject gas into like a surgery site, or we'll go back to the conversation about the root canal. If you have a tooth that's sensitive, and every time I eat refrigerated fruit, I'm just like, whoa, I get electrocuted. I can put ozone gas right at the tips of that root and inject that ozone gas there, and that helps the body to heal and that tooth to heal. But if I'm treating, so we're using it as a therapy inside the mouth. Mm-hmm. So what I have a unit that actually puts out the gas through a small little cannula, and so I can put it exactly where I want to.
Focus it and put
Focus
it. It's not like a gas mask.
No.
Targeted.
We actually don't want you to breathe it. I want you to breathe through your nose when I'm using it, because if it gets in your lungs without running it through an oil, which I'm not, I'm focusing on other things, then it'll just cause you to cough. And so we try to avoid that.
Okay, all right. Now, I've had 4 of my 5 kids get their wisdom teeth taken out by you, mm-hmm. and each time you've progressively added things to the protocol, right? So
Always.
Tell me where you're at. What have you incorporated from holistic dentistry into wisdom teeth removal?
So one is a concept of understanding when we need to have wisdom teeth out and when we don't need to have wisdom teeth out.
Right, so, because that was my question to you many times before, right? Like, why do we even do this now? What did our ancestors didn't have to take out their wisdom teeth, so why do we do it in the modern age?
Let's come back to that in about 5 minutes. First, I'll answer the wisdom teeth, and then we'll come back to the ancestral cranial structure. Mm-hmm. So, taking out wisdom teeth. If we have room for the wisdom teeth are upright, and the patient is keeping them clean, I wouldn't take them out.
Okay. So it's not an automatic.
It's not an automatic. If we don't have room for them, so like back here, the jaw comes down and turns to the side. Mm-hmm. And so if we don't have room and it's tucked all the way back into the jaw bone, it won't come all the way in. And so it becomes a food collector. Mm-hmm. And so that's one reason that I'll be like, that's got to come out of there. Another is if instead of coming in straight, he's coming in sideways. Mm-hmm. Again, he serves no functional purpose, and he's going to destroy the back of the other tooth. So that's another reason I would want to. The third one is some patients just don't want to brush that far back. And so if we end up with cavities or we end up with periodontal disease towards the back, then I have that conversation with them. We need to get these guys out of here now before you end up with a big infection. Mm-hmm. So those are the number of reasons that I choose to take them out. But if they're upright, they are clean, and you have room for them, we don't need to take them out.
Okay. What do you think? I'm just curious about the percentage of patients who that happens for. Because in my family, it's not happening at all.
It's not a super high number. I'd say maybe 3 to 5% that they are upright, they're clean, and they have room for them. And now we can jump over to why.
Well, no, let's go back to your protocol. What have you added?
Oh, okay. So, yes, so many things have changed. Mm-hmm. So when I take out the wisdom teeth, adding PRF, which is platelet-rich fibrin. So when I talked about prolotherapy, where I draw blood, spin it down, throw a bunch away, and inject it in, that's called injectable PRF. I'm doing solid PRF. So I don't want it to be injectable. I want it to be a big slug that I can put into a clump. Exactly. So I can put it right into the surgery site. That's all the chemofactors that I get, that I place down into that site and sew that all up. So that helps it heal faster, reduces pain. Great. I've added ozone where I'm going in there, I'm detoxifying. I've also added laser and removing the periodontal ligament. So I'm getting in there, I'm detoxifying the periodontal ligament, I'm removing all of that. And
what do you mean by ligament?
So we love to think of the tooth as being set in bone, but it's not actually set in bone. It's in a sling of 250,000 to 500,000 little teeny tiny fibers. And so we can't see them without a microscope, but they're these tiny little fibers. And those little tiny fibers are a ligament.
So they're not the tooth itself, it supports the tooth?
Correct, it supports the tooth. So once the tooth is out, there's all these little torn fibers on the edge. And the reason we're wanting to take that out is if we don't end up getting that out, we can end up with a cavitation. So that's an incomplete healing inside the bone that results in the bone not being completely dense and or having places that have insufficient blood supply or insufficient conductivity. Okay. So those are the things that I've changed. Oh, I also, when I have a patient that's getting IV sedation during surgeries, I've added vitamin C, added magnesium. So I'm adding supplementation in during the surgery to stimulate their bone healing.
Okay. What does the laser do? Is that part of the
So it
ligament?
detoxifier works to remove the periodontal ligament, also stimulates blood supply, and so it encourages bleeding inside, which when you cut yourself on the outside, you don't want it to bleed.
Yeah.
But when you're doing surgery, you want it to bleed because bleeding is where you get healing. And so it removes the periodontal ligament and encourages and stimulates bleeding.
Yeah. So what's been the response from patients for this?
The response as far as how they feel the surgery went?
Yeah,
or,
and recovery time, if you have gotten response from them.
I don't know that I've seen a huge change. I don't have post-operative complications. It's rare to have post-operative complications. And the amount of pain that my patients have is very, very low. So that aspect is great. And what I love is where you end up with like a split trial. So I have patients where there's 4 siblings and 2 go to one doctor and 2 come to me. Okay. And then they're like, oh, that was crazy. 3 days and I was great, or 2 weeks. Yeah. I mean, it can be quite drastic. Now, everybody's different. I've had patients that it took some time to heal. And I've had other patients that are like, I felt like $1 million 12 hours after my surgery. I don't care. I still want you to take 24 hours of laying low.
Yeah. I'm sure it also has to do with how they're walking into the procedure in terms of health and taking care of themselves. And because, like we've talked about before, that affects your healing.
Absolutely, 100%. I mean, all of the things that I listed as what it takes to have a really strong holistic life, all of those are going to come into it. If you are sleep deprived, your body is not doing very well. If you're eating junk or not eating at all, you're not doing great. If you haven't exercised at all, you're not doing great. If your autonomic nervous system's a total wreck, you're not doing great. Yeah. We have infections, we have toxins. I mean, we've got problems. You've never taken a vitamin in your life. I mean, I've got a long way to go to keep you healthy. Mm-hmm.
Okay, let's circle back to our ancestors and why do we struggle with wisdom teeth now versus what happened in the past?
So Weston Price wrote a book just a little over 100 years ago on development of the jaws. And he was a dentist. He graduated from Loma Linda, which is my alma mater. So it was really, really groundbreaking when he published it. Mm-hmm. He also published another book, which I've never seen anybody else talk about, but just because I graduated from Loma Linda, they have a library that has every book ever written by a Loma Linda graduate. And it was about his kids. And his kids never brushed their teeth in their entire life. and never had a cavity.
Wow.
I wouldn't recommend that, but and now we're getting off onto diet, but I'll talk about diet and then I'll come back to jaw development. If you never eat sugar in your entire life, you will not have a cavity, period. Because what sugar does is that sugar, specifically sucrose, because sucrose is one fructose, one glucose molecule in a high energy bond together. And there is only one bacteria that I know of inside the body, and that is Streptococcus mutans, that takes that sucrose molecule, it breaks it in half, and then with the energy from that high energy bond, it allows it to glue itself to the enamel of our teeth. And so he can stick to the teeth with that high energy sucrose bond, and then once they're stuck there, then they can start using their acid, which is a byproduct, it's their waste, to eat their way into the tooth. So you've got to have sucrose to keep them from just getting washed away when you drink a glass of water or swallow or eat. And so that sucrose is what allows that to happen. If you've never had sucrose in your entire life, or you've never had sucrose short of, say, an apple or whatever else, then you can't get a cavity. And that's what Weston Price proved with his children. There's a secondary research, which was also done at Loma Linda, which talks about the dentinal tubule fluid flow. And so the dentinal tubule fluid flow, again, we like to think of teeth as being solid. They're not solid. If you took a stack of coffee stir straws, they look solid and you could stand on them if you got a big enough stack of them together, but they're full of holes. And the same way with the tooth. It's full of these dentinal tubules, and all of these dentinal tubules have what's called fluid flow. So this fluid is coming from the inside where the nerve is, and it's pumping out. When we consume sugar, that fluid flow stops. Depending on the sugar and the length of, or the amount we consume, it's somewhere between 1 hour and 3 hours. So during that time, bacteria can start to wander their way into those dentinal tubules and attach themselves deeper and deeper into the tooth. So if we've never consumed sugar, we have a perpetual flow of fluid out, pushing the bacteria out. Again, encouraging health. So sugar, A, gives the bacteria a bond to stick to the tooth, and B, turns off that flow that helps wash the bacteria out. So sugar's a double strike.
So if I'm interpreting you correctly, does that mean if we eat sugar but brush our teeth within 1 hour, it won't cause a problem?
If you consume sugar, you can brush and floss and protect your teeth. If you do not consume sugar, then we don't end up with cavities, except for in rare occasions when you can totally and completely blow the system out. And I believe it was Socrates who originally made this statement, and I love this statement. It's very, very wise, although completely wrong. Okay. At that point in time, he believed in tooth maggots. And so we had these maggots that ate holes in teeth. And he said that the flies for the tooth maggots laid their eggs on dates, which is brilliant, incredibly brilliant. If you go back 2,500 years and try and find a source that has sucrose in it that's strong enough to give you cavities. Dates. That's the only source in the ancient world to get cavities. So he was smart enough to realize dates are where you get cavities. I mean, he was wrong about the tooth maggot part. We know it's bacteria now, but that's still pretty brilliant. Even though he was wrong, he was still pretty brilliant. Yeah. So, and I like to also share that with people in the holistic world who say, oh, if it's natural sugar, it's not a bad sugar. No, not
That's
true.
That's a good point. I like my honey, but I have to be careful with that then.
Absolutely. Yes, I mean honey, agave syrup, maple syrup, brown sugar, organic cane juice. I mean, all of those, you can still get cavities from them. If you have sucrose, you can get cavities from them. And if we want to talk holistically, we have to not just talk about cavities, but we have to talk about your health. And I mean, Dr. Lustig, he has gone way deeper than I will ever be able to go on metabolism and sugar and what happens to your body when you're eating sugars that are not coupled with their entire food. So he specifically, I'm trying to believe the book, I believe was Metabolical by Dr. Lustig, and in there he talked about consuming an apple versus drinking that same apple in apple juice. And he walks through the metabolic consequences of doing that on each side, which was truly amazing because inside an apple is both soluble and insoluble fiber. And so when you're consuming that sugar with the soluble and insoluble fiber, it completely changes how your body absorbs it. So that is, I mean, if we're talking metabolically, we've got to look at that as well.
Yeah.
And again, everything in moderation. We have worn the continuous glucose monitors just to keep track of what different foods do to our body.
In your family?
In my family. And I don't know if I shared with you, but my son decided to eat 12 oranges and his glucose monitor went off like crazy. Don't eat 12 oranges. We aren't meant to eat that much. It might be natural, but you have an incredible glucose spike.
Okay, so we still have to go back to structure of our ancestors.
Yes.
I have a question about cavities then we've been talking about because I've heard, and I think we've talked about it before, that some people are more prone to cavities, some people are more prone to tartar. I'm more prone to tartar, but some of my family is more prone to cavities. Why is that?
So ultimately that, and this is my opinion, not the opinion of the ADA, because they shy away from this statement. It has to do with your acid-base balance. Okay. If you are more acidic, you are prone to cavities. If you are more basic, you are prone to tartar buildup. And so that...
Now, is that in your whole system or you're talking about in your mouth?
Both.
Okay.
And because you can't separate your mouth from your whole body.
Okay.
So and there are ways that we can push towards acid, and eating inflammatory foods push towards acid, and eating sugars, which is an inflammatory food, pushes towards acid. So the more non-inflammatory foods you eat, more vegetables, more whole foods that you are eating, the more basic your body is going to be, and the less likely you are to have cavities.
Okay. Interesting.
So we talk about the multifactorial aspect of tooth decay. There is a genetic component. That is probably the smallest component of anything. Yeah. How much sugar you eat, how frequently you eat that sugar, and then whether or not you brush and floss well. Those are the biggest issues that are going into it. There's something called the Stevens curve, which looks at when you have an acid attack, which is caused by consuming some fermentable carbohydrate. That can be sugar, that could be simple carbs as in bread or cracker or rice or anything like that. You're going to end up with an acid attack. How long does that acid attack last? That acid attack will last roughly 60 to 90 minutes. And then when it's over, then your body comes back to basic. So during that acid attack, your body is being attacked with acid. And then once it's over, your saliva, which flows, is going to turn around and start to remineralize that. Now, if you get yourself a massive sweetened coffee and keep it on your desk from 8 o'clock in the morning until you slip into bed at 10 o'clock at night, you are going to have rampant decay. And even if you tell me I don't eat candy, but you have a sweetened coffee drink.
Or a Diet Coke.
Well, Diet Coke's going to be different. It's going to have the acid, but it's not going to have the sugar. So it's half as bad. Okay. It's still not fabulous, but it's better, but not good.
So you're saying the saliva, that's where our base or acid
Correct. Our saliva washes it out. You can think of the saliva as your police force. And so, I mean, any city, if you fire all the police department, you're going to have crime increase. And if you think of decay as the crime, that's what you're looking at. And here we get into a lot of the problems with the traditional medical system. Anytime you have anything, we give you a medicine. The from my understanding, the number one most common side effect of all medications is dry mouth. What is dry mouth other than cutting off your saliva? So,
and you need the saliva to clean it out.
Absolutely need the saliva.
Okay, this goes to a question. This might be a what do you call it? Mother's tale. What's the name?
Wives' tale?
Wives' tale. Thank you. The wives' tale. That if I don't have time to brush my teeth, I could eat some cheese, and that will create saliva, and that will clean my mouth. How does that fit into it? Because it sounds like if I'm creating saliva, that's really doing the trick.
It's better if you're creating saliva. And cheese is one of the non-fermentable foods. Mm-hmm. So cheese is just fat, basically, fat and protein. And so it's non-fermentable.
And no sugar.
So, correct, no sugar. I know that everybody makes a big deal about how carrots have sugar in them. Mm-hmm. I have never met somebody who eats only vegetables that has a cavity problem. Mm-hmm. So if you want to eat carrots, I do not, I mean, maybe you could in a laboratory make something up so where somebody's getting a bunch of cavities from carrots, but I have never seen that in my practice. Mm-hmm. If you're eating cucumbers and carrots and celery and whatever, bell peppers, and that's like your go-to snack, yeah. I don't see those people with tons of cavities. I've never had a patient who tells me, I eat nothing but vegetables, and they have a cavity problem. So do vegetables have sugar in them? Yes, they do. But I don't believe it's enough other than on paper. We can say on paper that it's enough, yeah. But I do not see that happen clinically with my patients. So if you don't have enough time to brush your teeth, I mean, rinsing with water, eating a fibrous food, yes, that's going to help. It's not quite as good, like not quite at all as good as brushing and flossing.
Right. In a pinch.
Yes. Not a solution, but.
Okay. So yeah, what you're saying is it's not wrong.
It's not wrong, yeah. But I don't think you're getting 100. You're going from 0 to like 10.
Okay. All right, now let's circle back to our ancestors and what's changed between their jaws and our jaws.
So bone structure has changed tremendously. Now, why? There is a lot of doctors that have dove into this, a lot of authors, a lot of great books. Why We Breathe, 6-Foot Tiger, 3-Foot Cage. Trying to think of others. I know there's been several other books, but we really dive into what's going on. And there's a handful of things that are causing that. One, we have grain mills, which are grinding up the grain. And so we don't have to work nearly as hard to actually eat as we did 300 years ago or 400 years ago. As well, we are eating way less vegetables. We are a carb-heavy society now. Mm-hmm. And grains do not spoil the way vegetables do. You can't put up cucumbers to last you a whole winter. I mean, you can pickle them and get pickles, but you can't have fresh vegetables all winter long. It just won't work. All fresh vegetables, you're going to have to consume them or they're going to rot. And so as we started growing larger and larger cities, we tried to figure out how we could have more and more food in a smaller and smaller space. And as we do that, we get more and more grain intensive. Mm-hmm. And grain is a higher caloric intake with less and less work. So as we are working our jaws, mm-hmm. we are pushing our mouth apart. And I do not know where the research was done. I cannot remember the author of the article, but they were looking at children who nursed for 2 years, had 0 sleep apnea. So that is another really, really fascinating characteristic, because you look at that and you go, nursing is harder than drinking from a bottle. Mm-hmm. And drinking from a bottle, it's way, way easier for the baby. I mean, I mean, we've all seen that baby that's got the bottle, they're holding it with their feet and they're just chilling and it's just kind of flowing in and they're just like swallowing it. And then the other is that it's a short step. Once you get a baby on a bottle, then you're adding the formula in. The vast majority, if not all formulas, the number one ingredient is high fructose corn syrup. I mean, that is, again, this is work from Dr. Lustig when he was looking at children who had type 2 diabetes before they were turning 3. Wow. I mean, that should never happen. Should never happen. And we were seeing it happen. So we're giving kids food that is horrible for them, which is going to mess up their ability to grow good bone structure. And then we give it to them in such a manner that we're not stimulating the structures of the skull to actually grow the way it's supposed to. And this is hotly debated. There's an index called Punt's index where they measure the maxillary incisors and then create a formula to look at the width of the arch and say, is your skull the correct size for your head, basically, or your teeth? Is it the right size for who you are as a person? And the University of Pennsylvania Dental School did a research that they looked at that, and they basically took epidemiologic data of patients and said, Punt's index is wrong. It's way too big. We don't need nearly that large of a skull, and we can prove it by the population. My argument would be that the population all have small skulls. And so are they accurate in saying that's what they see in the population? I think they're yes, absolutely, it's accurate. But that's not the correct question. The correct question is this the optimum size of the skull, not what we're seeing? I mean, sleep apnea is hitting like an epidemic throughout our country. And I think that it's part of the problem that happened in the 50s and 60s when they said, quit nursing, give your baby the factory formula that's designed for their health. And we just started separating kids away from growing up naturally. And we're paying the penalty for that. And then you end up taking out first molars during orthodontic extractions. And so they extract and collapse, which was really popular in the 70s, 80s, 90s, and sometimes even now. Extract and collapse, and you just end up pulling the jaws backwards and collapsing in the cage for your tongue and causing those problems. So as we got away from growing our own food, we got away from, when you eat a bread that's made from pounding wheat between two rocks, it's a pretty coarse bread. It's gritty. It's work to eat that. And so you spend a lot more time working at eating. And I love going on mission trips overseas and wandering around in foreign countries. You see people that just work at eating. Like you're in the Caribbean and you'll see somebody chewing on a mango seed for an hour. Wow. You don't see that in America. No. Everything is about how quick can I eat? Yeah. If it takes me a little extra time, I'm just going to throw it away. I'm done. I'm not going to work at this anymore. I mean, I've met people that have never eaten an apple off a core because they say it's too much work. Really? Yes, and just that concept of working at actually eating food is totally different.
Oh yeah, our whole society is streamlined and get things done as quickly as possible. You don't sit down and enjoy a meal as much. I'm surprised at how many people I talk to that don't have family meals, that don't sit down and just enjoy that time. It's just quick grab and go, grab and go.
And think about, when we talk about all the aspects of a holistic life, think about how many of those are covered in a family dinner. Mm-hmm. I mean, I would hope that it would be a healthy dinner, so we're going to say diet. You're sitting around having a conversation with your family, and it's a social environment. So you're not stressed, you're not sitting in your car while you're driving through traffic trying not to drop ketchup on your lap. So you should be balancing your autonomic nervous system at that point in time. Hopefully these are people you like with your family, so it's part of who you are as a person. It's part of your purpose in life is your family and your relationships. And so right there we got 3 of them. We have 3 of the aspects of having a healthy life just from sitting around the table and eating. And if we're going to talk about diet being healthy, let's talk about that being a well-cooked meal with good food and it's well sourced. Then you're going to have a very low toxin level as well. So we can tick 4 boxes with this. So yeah, it's an amazing thing, but it's purposeful. You have to make the concerted effort to say, I want to have a meal with my family and I want my family to have this meal with me.
Right. And it takes a lot of prior planning, takes margin in your life to be able to set aside that time.
Absolutely.
Yeah. And work to make the food.
Yeah. 100%. 100%. And then commitment from your family as well. It's easy when they're little, but as they get older, life gets busy. They go 100 different directions at all times. Yeah. Sometimes I'm happy just knowing where they are, even if they're not here.
Yeah, that's true. There's different phases of life, right, where you can focus on different things. And this is kind of where it comes into what you were talking about earlier. Of what are your goals in life? Are you just trying to stay above the disease level, or are you trying to maximize overall health? And, how do you fit your life into that also, and goals?
Yes, and there's always 100 different ways to word things. And Dr. Joseph Kim had an absolutely fabulous way. We were talking about various aspects of holistic life, and he was talking about diet. And he was specifically talking about eating meat in your diet of being meat that only ate food that you would want to eat. And I loved that statement, because if you're eating meat that is eating junk, it's not good meat. Mm-hmm. And so it was I just loved that statement that he had, the eating meat that eats things that you would want to eat.
Yeah, it's a full circle.
It is.
Yeah.
It is. If you have, some feedlots, they're chewing up dead animals to feed them. That's not going to produce good meat. Mm-hmm. Versus look at your omega-3, omega-6 ratios for animals that actually eat grass. And I was reading, I can't remember where it was American Rancher. It was a magazine on ranch and agriculture, and they were actually comparing the omega-3, omega-6 ratios from animals that grew up solely on pasture and animals that grew up on pasture that had greater than 6 separate species of grass. And you had better ratios in animals that grew up in pastures that had more than 6 species of grass, which I thought was awesome. I was like, that's really, really neat. Yeah.
And remind me again, what should the ratio be? Isn't it 1 to 3?
Off the top of my head, I do not remember.
Okay. So what you're saying now is that our diet is really what's changed from our ancestors. And it's less work to make, it's less work to chew. The quality, we're carb heavy instead of more meat and vegetable heavy, because we're in a more industrial modern society. So, and I know Weston Price's work when he went into places that were not modernized, and native tribes had no problems with their teeth, right?
And jaw structure. That was the other one, is to look at jaw structure. And we consider it almost ubiquitous when you start looking at middle school pictures. You have the 2 canines that poke out on the top and the bottom. I mean, that's just like normal America. But what that is that's a jaw that's not big enough. You don't have the structure that you need for your teeth. Mm-hmm. And so ultimately we have a couple of different ways that we solve that in dentistry, orthodontically, looking at expanding that structure or pushing those teeth out with wires, or some orthodontists will choose to extract teeth and then kind of pull everything in. Mm-hmm. And so I tried desperately hard not to ever take teeth out, because that's your cage. And you're collapsing your cage.
Mm-hmm. So how does the holistic approach affect
Orthodontics?
Yes, orthodontics. Thank you. I was thinking of braces. Yeah.
So the holistic approach, and now we can get into a bunch of different sides of this, because first we really want to make sure we have structure and growth. Do we have sufficient room for our teeth? So if possible, expand so that we have sufficient room. If possible, get the jaws aligned young. Young 6 to 10, somewhere in that range. Get them big enough and get them in the right position if possible.
And you can know at that age whether they're not sufficient.
Yes and no. Class 3 jaw, which is where the lower jaw is further forward, that tends to grow very late. It tends to happen, and it can happen early, but it can also happen really late. And it's all relative. Really late meaning like 16, 17, 18. Okay. Most of the time orthodontically we're done by that point. And so it does happen sometimes where you're completely done with orthodontics and then all of a sudden their jaw starts growing. And we end up with a relapse and have to treat it or not treat it. So that's an aspect that sometimes we can't treat it. Sometimes we can, sometimes we can't. Holistic orthodontics. Metals, they can conduct various currents, various electric issues in waves. And so then we have this questions of, are metal braces a good thing or not? That's really hard to answer because there's a lot of teeth that we can't get to go where we need them to with plastic aligners. So then we have to ask the question, are you completely happy with a 70% solution with plastic aligners, or do you want to use metal braces and then accept the metal that we're going to be using during this period of time? As well, even when you're looking at 9 years old and we're doing an expander, there are no plastic springs. There's nothing that we can use to push that doesn't have metal in it. So if we're looking at that and we're saying we want to be holistic, we have to create what we decide is the appropriate amount of holistic for that. So if we say we want zero metal whatsoever, but we have a collapsed jaw, I don't have a good answer for you. So are we willing to live with some metal right now to protect our child from having sleep apnea in 30 years? I would say yes. But that's a decision that each person needs to make. I don't think that's a decision that I can make for every one of my patients. My goals are to use the least amount of metal and the least amount of time that we can, but sometimes we can't not. Or we have to have a circumstance where we say, I'm fine with a 70% solution, understanding that the plastic is not as strong and it's not going to give us the same results that we would get from metal.
It's really looking at the worst outcomes or potential problems in the future.
Yes. And
weighing those costs. Okay, let's talk about fluoride. This is a hot button. So when I went down the rabbit hole of functional medicine, everybody warns against fluoride. Fluoride's evil. There were some bad research studies before that got us started. Where do you sit in terms of fluoride and how effective it is and the dangers to our body?
So I think the first thing we need to do is really dissect this apart, because the fluoride that originally started all of this way back when was calcium fluoride, which is what occurs naturally in the water.
So we already have fluoride in the water, you're saying?
Yes.
A natural element?
Yes, okay. Calcium fluoride. And that is really where everything originally started. And with calcium fluoride, that's pretty much where the research was done. I believe it was in Colorado originally. And then they started with adding fluoride in, and that's where stuff really started getting askew. Because when they started adding hydrofluorosalicylic acid, which that's the byproduct of aluminum manufacturing. And this is where knowing just a little bit makes things really, really messy, because and there are people that say this, they're like, all fluoride is the byproduct of aluminum. No, all fluoride is not the byproduct of aluminum. The hydrofluorosalicylic acid is a byproduct of aluminum. Toothpaste does not have hydrofluorosalicylic acid. It has sodium fluoride. So if we're just talking about what's going on in the toothpaste, that's not the same thing. Even back in dental school, which is hardcore right inside the lanes, drinking fluoride serves very little purpose in what serves the patient. Okay. High concentrations of fluoride on the surface of the teeth is what serves the teeth. And again, we have to be just talking about the teeth and not talking about the whole body. Because if we coat you with fluoride, you're going to consume some of it. And so if we're, again, coming to the holistic conversation of what's most important for your entire body, then I would say fluoride is not the best decision for that. So if we're having that fluoride conversation and saying, what's the best thing that I can have, I would look at like hydroxyapatite or really impeccable oral hygiene, removing all of your fermentable carbohydrates, things like that. Sometimes we end up with a patient who's unwilling to do that. They're like, I can't give up my sodas, I can't give up my sugars, and then we have to weigh the benefits and the detriments of it. So is it better to have fluoride, or is it better to lose all of your teeth due to decay? That's a question I can't answer. Each patient has to answer that for themselves. And so those are circumstances where we need to have a deeper conversation about that. I mean, first step, cut the sugar out, cut the soda out, step up your game on brushing and flossing, and then we don't even have to have that conversation. But if that's not where we're at, then we are going to have that conversation.
Yeah, that's interesting to hear you say fluoride itself is not the evil entity, right? But it's where it's targeted, what kind of fluoride, and where it's targeted. So there's a difference, which a lot of people don't talk about, distinguish like the fluoride in our water that the city puts in that we drink versus when we come to you in the dentist's office, you're putting it in a very specific area. So
Correct.
They have different effects on our body.
They have different effects on the body, yes. Mm-hmm. If you are looking at, you do not have issues with cavities, then I wouldn't use fluoride at all. Mm-hmm. So if you're not having cavity issues, we don't need fluoride. Mm-hmm. And we know that fluoride binds stronger to the thyroid than iodine does. So don't put something in our body that's going to mess with our thyroid. Mm-hmm. As well, we also know that fluoride is a neurotoxin. What level of it becomes a neurotoxin? That's currently being hotly debated in the legal system right now. But some of the aspects that get really super muddy are how are we dealing with dosage? And we live in Texas. We drink a lot of water in Texas. Yeah. So the amount of fluoride per water in Texas should probably be much, much lower than it would be in, say, Wisconsin, where I'm freezing. I'm not going to drink nearly as much water as I am when it's 105 degrees outside. So that's another aspect that becomes very, very difficult to have a conversation about when we, as an entire country, say, this is how we decide what dosage we need and where it should be.
Do you think there should even be fluoride in the water? Like, is it even helpful if you could put it straight on your teeth when you go visit the dentist? Or is the problem people don't go to the dentist, and so as a public service, we're putting it in the water?
You asked a whole bunch of difficult questions there. So epidemiologically, we have to have that conversation. Epidemiologically, are we talking about the entire population, irrespective of whether you see the dentist or not, or irrespective of whether you brush your teeth or don't? So, because if you don't brush your teeth and you don't see a dentist, then your only option is fluoride in the water. But then the question comes in, do we treat the entire population with a drug even if it's only specifically needed for a small population?
Right.
I would say no, but I'm kind of a personal responsibility kind of guy. So that's where I come in, is that we have personal responsibility to make that decision. And if you want fluoride, there's a lot of fabulous fluoridated toothpastes. And you can grab a fluoridated toothpaste and use that every single day.
So that will have the same effect.
It'll have the same effect, and it'll be better because it's actually on your teeth instead of drinking it. And so it's inside your body. Because systemic fluoride has little or no effect on your body. We're going to much higher doses to have systemic fluoride be effective versus fluoridated toothpaste.
Okay, let's talk about toothpaste. So I stopped using, I did get a sample from you. I don't know if we want to plug the sample of FIG, FYGG, which my husband and I love. It's been our favorite, like, holistic kind of toothpaste, natural, without any toxins. But before that, I kind of like to switch up. I don't like to do the same thing every single day and give my body something to react to. But so I use, before this, I was using salt and baking powder. Right, and so, or baking soda, which seemed to clean my teeth very well, right? So if those natural products worked, why did we ever start using toothpaste? and why don't dentists say this works just as well? Like, why aren't they educating the public? Because dentists, are they getting a pushback, like, you know?
So this is, you asked an hour ago, how long does it take for science to get through? There was a really bad bit of research that was done, and I don't even remember when it was done. It was like the 50s or 60s. And they said that baking soda caused erosion on teeth and it should not be used.
Okay.
It was not a well done piece of research, and it has become a seminal piece of research, even though it's bad research. And even though we have done a dozen to 100 articles now and proven that baking soda is fabulous for brushing your teeth, people still run back to that. No, you can't do that. It causes abrasion, it causes erosion. And so that's part of the problem, is we have dental dogma that's running through. So if you, and even, this even happened, oh goodness, probably 15 years ago was the first time I was hearing brushing with baking soda for patients that have high caries risk. So you just get a shot glass, fill it with baking soda, wet your toothbrush, dip it in the shot glass, so it sticks to it. That's all the purpose the water does, it just make it stick to your toothbrush, and then brush your teeth. And it works great. I mean, dirt cheap.
Yeah.
You buy 5 pounds of it for $5 or whatever. I mean, it's a lifetime supply. So yes, the cost is very inexpensive. Look at Benjamin Franklin had a toothpaste recipe, which was baking soda and charcoal. I'm not a big fan of brushing with charcoal, but I mean, it's an option.
What's the purpose of charcoal? Because I know that is in some natural toothpaste, charcoal, right?
I don't really know the purpose of it. I mean, if you're taking it as a supplement, it's being used as to pull out toxins and to specifically heavy metals. It'll collect with heavy metals and then be passed.
Oh, right. Okay.
But now we've talked two different things. One, we're talking metabolically. The other, we're talking on the surface of your teeth. So I'm not exactly certain what the purpose is. Maybe it's just another level of a grit that you're adding in.
Okay, so I was looking up some ingredients, bad actors in toothpaste. We talked about fluoride. You're saying that's not necessarily a bad actor.
Well, I would choose not to use fluoride if you don't have cavity issues. And if you do have cavity issues, the first thing I would choose to do would be reduce your sugar, reduce your fermentable carbohydrates, master brushing and flossing. You're going to take care of the vast majority of your cavity problems if you will do those things. And I would choose not to use fluoride. I personally choose not to use fluoride. And I control cavities in other ways. And that would be my decision. When you talk holistically, that would be the direction I would go. If we have a patient that has rampant decay and we're struggling, then fluoride might be the best option for that patient.
Yeah. Okay, some other ones: artificial sweeteners, ethanol, surfactants, propylene glycol, of color pigments, triclosan. I guess it's a type of pesticide.
Why do we need pesticide in our toothpaste?
Glycine, flavorings, which we never know what flavorings are, and some other things, carrageenan. So what would you recommend from a holistic approach? What should you look for if you don't want to do the baking soda because it seems kind of like weird? What would you recommend to look for? What ingredients should we look for?
You should be looking for the cleanest, the most simplistic ingredients that you possibly can. And if they don't give you the ingredients, I wouldn't use them. And because one of the problems that we are seeing, or I am seeing over and over, is that they're only doing like one thing. Like they might remove fluoride, but then they have dyes in there, or they have sugar alcohols. I mean, they have all of these other things that cause all kinds of problems, like apparently pesticides. Why we have pesticides in our toothpaste, I don't know. But we don't need anything else in there. It's, for all intents and purposes, you can brush with water. So then we have to ask the question, what is the active ingredient, or what are we actually trying to get from the toothpaste? Because if you brush with water, you're just brushing with a brush. And so you're using mechanical stimulation to remove the plaque or buildup on your teeth. So then the next is, if we wanted to add something, we could add a little grit. Most toothpastes use silicate, which is ground sand, or you can use baking soda, like we just talked about, or Benjamin Franklin, grind up charcoal, something like that that's going to give you some grit to clean your teeth. So that would be the second level, would be some sort of little bit of grit that you're adding in to your toothpaste. Then you could be talking about any sort of chemical that is, I shouldn't use the word chemical, any sort of additive that is being used for medicinal purposes, such as oregano oil or mint or some essential oil or something like that.
Antibacterial, antiviral type.
Yes, potential microbial aspects of it, or flavor, a flavor enhancer. A lot of those are designed to kind of give you that foamy reaction.
Which you won't get with just baking soda and water.
No, you won't get that.
It is interesting that we've been trained to expect that. But that doesn't really do anything.
No. The foaming action does not dictate whether your teeth are clean or not clean. Yes, it is something that is very common in the toothpaste. And if you're like, I have to have a foaming toothpaste, then you're going to have a lot more ingredients than somebody who says, yes, I want a super clean toothpaste. And one of the aspects, like FYGG, they have on their toothpaste, you need the toothpaste to mix it up so that it doesn't separate. And again, what level of clean are you willing to do? Because if you're like, oh, gross, my toothpaste separated, then you're not happy with that. If you don't care, need your toothpaste, mix it up, and then you can have a much cleaner toothpaste. And if you think about it, you're using something that's potentially been mixed a year ago and it hasn't separated. There's a lot of stuff in there.
A lot of extra stuff. So the lesson is, just like we should be looking at labels and ingredient lists on our food, we should be doing that with our dental products
100%.
Also. As we wrap up here, what's one myth about your dental care that you wish you could erase forever?
One myth about dental care that I wish I could erase forever. Probably saying, and this comes from women, telling me that their baby stole all of their vitamins and minerals. And my baby took all of my vitamins and minerals from my teeth, and that's why I have bad teeth. The baby will take from mom. Yes, 100%. If they didn't take from mom, the baby would not survive. However, the vast majority of those problems are caused by post-secondary issues that are happening during pregnancy. A, nausea and vomiting. You're vomiting, and so we're hitting our teeth with acid. And we just pour acid all over our teeth, and that leads towards tooth decay very aggressively. Second, you get incredible munchies. I mean, I've been woke up in the middle of the night and told to go on a burger run right now. And so, yeah, very reasonable. Good husband, go. But I mean, never have I ever had that happen when she was not pregnant. Right. But when she's pregnant, I mean, you'll get, I need this, and it's very specific, and you better not substitute anything. You need to go get exactly that. Or I want popsicles. She consumed massive numbers of popsicles during 2 of the pregnancies, but none of the others. Mm-hmm. And so these are the things that end up happening where we end up with cravings, we end up with changed habits, we end up with vomiting or nausea. We mess with our habits. So we're not brushing, we're not flossing, we're eating like crazy, we're eating foods we don't normally eat. If you're a little bit nauseous, often they'll tell you, your OBGYN will say, drink 7-Up, which, I mean, I understand. If you can't get anything down, you should drink whatever you can to get it down. But if you sip on 7-Up for 9 months, you're gonna have a lot of cavities. Mm-hmm. So again, back to the holistic statement, every decision we make, we have to look at both sides of that. Yeah. And if we sip 7-Up for 9 months, we're gonna have cavity issues. If we choose to eat popsicles for 9 months, we're gonna have cavity issues. If we say, I'm gonna brush my teeth after the baby's born and skip 9 months, we're gonna have cavity issues.
So don't blame the baby.
Don't blame the baby.
So what I get a lot from this conversation is we have a lot of personal agency. There are things that we can do to affect our overall health, affects our tooth health or mouth health, and vice versa.
Absolutely.
And sometimes we can do simple things and just simple adjustments to take care of our...
100%. I agree with that statement 100%. We are in charge of our life. Mm-hmm. And what we choose to do is going to make massive movements. I mean, do you need dental care? Yes, you do. But if you don't do anything with your life, and you go to a holistic dentist, is it going to make your life great? No, no, it's not. The same way if you go to a physical trainer, but you eat fast food all day, every day, you're not going to get much out of that work. I mean, the same aspect, it's personal responsibility. And then also, like we talked about the many different levels, focusing on the one that you're weakest in. That's where we see the best results. Dr. Attia he's really funny about this because he gets all fired up about it, where people will start arguing about dissecting down to the protein availability of this meal or that meal, or we should have X grams of protein in breakfast, but then change it in lunch and this in dinner. And they're incapable of doing one body weight deadlift. And so they're sitting here arguing from 9.6 to 9.7 in diet, but yet they're a 0 in physical exercise, or maybe a 1 in exercise. I mean, why? Why even argue about it? Let's get our physical exercise up before we start arguing about diet. Or let's learn to sleep before we argue about that. Or start to have some balance in our life and balancing our autonomic nervous system. And those are come full circle, getting ourselves healthy.
Great. Well, I appreciate having a dentist who looks at the whole body and is willing to think outside the box.
Thank you. Thank you so much, Jenny.